So I think we will start. People are getting the link and they're getting into the system. So first of all, I will like to congratulate all 11 people who have signed officially as an intern. Eliza, Nina, Mridula, Kanchi, Bola, Brinda, Fatimatul Nifa, Tejaswini Patil, Daksha, Srisa Ratnam, Mahi Patel, sorry, Bhumika Nagpal, Astha, and Uzma Kazi, as well as our four senior dietitians, Yusra Nasir, Fatima Haidari, Shaista Zabin, and Neha Babja. Now, congratulating Bhumika Nagpal for writing a very good blog. Bhumika, are you there?
Yes, sir. Thank you.
So your blog was very good, your charts were very good, and you just give your picture and Amir will post you tomorrow only. Okay?
Okay. Okay, sure.
And Yusra, you have already written two blogs. I think you were the fastest. You send all the things next day only. Your all the diet charts are very good, and I think we will start the program with you very soon.
Okay, sure, sir.
Yusra, are you there?
Yes, I'm there, sir.
So congratulations, your both the blogs. I think Amir is waiting for a good picture from your side.
So I will share it by tonight, sir.
Yes, yes. So he will publish both. One, your blog was on bariatric surgery. Second one was on weight loss. And Bhumika's Nagpal's blogs was on bariatric surgery. And Daksha, your charts were also very good. Actually, you have done an excellent job. And I think we should all congratulate them. You can just clap in the system. And people who have not done, if they want, they can do it. Otherwise, no. Now I tell you what is the advantage of these charts. See, when a bariatric patient will gain weight, or when they will get into the stage 4 diet after 6 months, these are the charts you will require, which we have already made. So you have already done part of your homework. I just wanted it to be separate for vegetarian and non-vegetarian, but some people have done both in one chart. It is fine. If you can make it vegetarian and non-vegetarian, one of your plans for post-bariatric surgery patients after weight regain or in phase 4 is already done. Okay. So now we will start today's module. Today's module is about Allurion gastric balloon procedure, and I will tell you how it is done in a very simple way. I think 99% of doctors don't know about this procedure, how it is done. So you are very lucky because today you will see the most minute details. We have done the first procedure in Delhi NCR 1.5 years ago when it was introduced in North India. We have done the maximum number of patients of Allurion balloon till now, and also we have done patients from all over the world. So why Allurion balloon will be there in future as well. See, people who have tried dieting and exercise, whose BMI is between 28 to 35 or 25 to 35, who are not eligible for bariatric surgery. They are overweight and grade 1 obesity. See, bariatric surgery, the patients were BMI more than 35 with diabetes or BMI more than 40. So for Allurion balloon, the BMI is between 25 to 35, people who are overweight and grade 1 obesity, who does not require surgery, who have tried weight loss by various diets, but they have regained weight and they want a push. So they will be the candidates for Allurion balloon. Advantages of Allurion balloon is it is non-surgical. It does not require any anesthesia. Previously, the balloons had to be put by endoscopy and also removed by endoscopy. In this case, no endoscopy for insertion, no endoscopy for removal, no hospitalization, as this is an OPD procedure of 15 minutes. But if the patient has insurance, then they may have to be hospitalized for 24 hours. And it causes weight loss up to 15%. So you can see this procedure, how it is done. See, this is a wire where the capsule is attached at the end. Okay. This capsule has to be taken with water. So 2 sips of water and the capsule is inside the stomach. Then we do an X-ray and we check the capsule is inside the place. Then we attach this thread to the filler liquid, which is already there. And then this capsule becomes a balloon. Okay, this is the actual balloon inside the body. It is a polyurethane inert material. It is vegan, so anybody can get it done. There is a stitch here which is dissolved after between 4 to 6 months, and this capsule passes, this balloon deflates and passes from below through the intestine in the stools in between 4 to 6 months. So how does it work? It creates a feeling of fullness, and people who are overeaters, they don't eat a lot initially, and if the habit is formed after the balloon is removed, they will still keep on eating slowly and in small meals. So this is actual procedure. You can see the capsule, which the patient is drinking water. One side is a male patient, other side is a female patient. It takes 5 seconds to reach the stomach. See, this capsule has gone into the stomach in actual 5 to 10 seconds. Then part 2 is the X-ray. So you can see by X-ray we can locate this thread right in the stomach. There are 2 contraindications of this procedure. If a patient has undergone a bowel surgery, number 1. Number 2, if the patient has hiatus hernia, which means the stomach is inside the chest. In those 2 patients, we cannot use this balloon procedure. 2 more patients are there where the balloon procedure cannot be used. If the patient is taking blood thinners and he has some cardiac event, and secondly, patient has severe cirrhosis and there are ulcers in the stomach, and patient has severe sleep apnea who is not on BiPAP and it is not controlled. This patient also had sleep apnea, but this patient was controlled, so we could easily put this balloon inside him. This is part 2, where the capsule is filled with this filler liquid, which comes with the kit. This filler liquid is 550 ml. So once this capsule is filled with 550 ml, it becomes a balloon of 550 ml. Okay. Then step 4 is another X-ray. Previously you have seen the thread. Now you see the balloon shape. Okay. This is the shape of the balloon. This is stage 4. Step 5 is removing this thread, which is very easy. It takes 10 seconds. So the total procedure time is 10 to 15 minutes and the procedure is over. It is a OPD procedure. So now all the steps in one go. From 1 to step 5. This is insertion of capsule. You have to drink with water. Takes 10 seconds. Then we do an X-ray to check the position of the capsule. Then we attach it with the filler liquid, which comes with us with the kit. So capsule becomes a balloon of 550 ml. It takes 5 to 7 minutes. After that, we do another X-ray to check the position of the balloon. And then we remove this thread, which is step 5. So all the steps have to be done in a proper way. So this is the completion of procedure. Okay. Again, you can see the 2 X-rays. See this X-ray showing the position of the capsule. This X-ray showing the position of the balloon. Okay. So these are our real patients. This lady who was 80 kg, she is a nurse. She became 68 kgs. This is our very good patient who did a very good activity. Till now, he is 72 to 74. Already more than 1 year completed. He has lost 24 kgs because his diet and exercise were very good. So this is about balloon. And 2 very important things, because you are all senior dietitians, you will be facing a lot of patients who want weight loss and their habit has to be changed. So the idea of telling you all these things is, I will be more than happy if later on somebody with bariatric surgery or somebody with Allurion balloon comes to you at your place and you can help that patient and even save somebody's life. That will be the Guru Dakshina that I will get once you learn this properly. Because trust me, a lot of doctors and a lot of paramedical staff don't know exactly how this procedure is done. So today you have learned about Allurion balloon procedure, and 2 tricks I will tell you for your weight loss patients. One is habit stacking. See, anybody who is already gained weight and you want to change their habit. So what we have to learn from them is a history, which may take 1 hour, 1.5 hours. Just learn from them their natural habits. Which thing is natural for them? See what happens. See, a lot of people, lot of you must be knowing how to drive a car. When we start to drive a car, we have to see where is accelerator, where is brake, where is clutch, how to move the handle on the left side. So every step is individual. But slowly, when you have learned and the brain knows that it is the same procedure will be repeated again and again, it is an habit and it happens naturally. Even when you don't recognize it, you drive a car naturally. Automatically, you will press the accelerator, the brake, the clutch, or you change the gears automatically. You don't have to think about it. This is how the brain works. It puts the important things after the brain has learned into the subconscious level where the brain doesn't have to do a lot of activity. The brain wants to rest. So you have to learn the habits which the patient already has. Suppose he has a habit of walking, he has a habit of reading book, or he has a habit of smoking while having during stress, or he has a habit of drinking alcohol when he is in stress. And during reading, when they want to eat, they eat all the wrong snacks. When having stress, they go for smoking. When having stress, they go for alcohol and they take a lot of wrong food with the alcohol, like all fried material. So habit stacking means add another habit with the already natural habit they are having, which is very easy for the brain to accept. See, when a patient comes to you and you give them a diet chart, it's a radical diet chart. Nobody in the world can do that radical diet chart. It's very tough. So you do one by one. See, if the patient has a habit of doing a morning walk, add a protein shake to the morning walk, they can take it. Because already they are doing walking. They don't have to force themselves to take protein in them. If a patient who has a habit of reading and eating the wrong snacks, ask them to replace their area with healthy snacks. The most important thing is to change the environment for habit stacking. How can you change the environment? You can ask them to empty their fridge, remove all Coca-Colas, all hard drinks, soft drinks, replace it with coconut water, replace it with buttermilk. Also remove all the sweets, replace it with fruits and vegetables. So whenever the person is hungry, they open the fridge, they are thirsty, they will eat, they will drink the coconut water. It is not Pepsi or Coke. See, Pepsi or Coke is 45 gram sugar, which is 225 calories in one Coke, which is equivalent to 3 rotis. And once they start drinking coconut water, buttermilk, obviously after drinking alcohol, your uh, thirst is not over. You want to drink more. But after drinking buttermilk and coconut water, thirst is taken care of, and most of the time thirst is taken care of normal water. Second thing, if they are feeling hungry in the night, they open the fridge. There are fruits, they can eat fruits. They are not no pastries, no sweets, so they will not do this. What can you say? Binge eating in the night. Somebody has a habit of reading book. Add healthy snacks to it. This is habit stacking. This is how you can improve their habits one by one and adopt. Ask them to adopt healthy habits. Second thing you can do in your patients is implementation intention. What does it mean? Suppose you want the person to walk next day, ask them to repeat it 5 to 6 times in a day, that tomorrow morning 9 o'clock I will go to this park and walk for 30 minutes. Then you ask them to write it on a and with a notebook that tomorrow morning 9 o'clock I will go to this close to my house and walk for 35 to 40 minutes. This is implementation intention, and with this technique the patient will start walking. See, we have learned that some people say that after the time of sleep, please help me, I want to wake up at 3 o'clock in the morning, 4 o'clock in the morning. When we are having exams, everybody has gone through it in 10th, in 12th, in graduation, in post graduation, we have given a lot of exams. So when you say I want to get up at 4 o'clock, you get up at 4 o'clock without alarm. This is your brain which is already doing it for you. This implement intention is asking your brain to follow that technique. So the patient, the person next day don't have to force himself to go for walking, because he has repeated so many times and it's automatized in the brain that tomorrow morning at 9 o'clock he has go to that park, he has travel for 30 minutes. It has to be crystal clear. Not like that tomorrow I will walk. No. Tomorrow I will walk for 10 minutes. No. Tomorrow I will walk for 30 minutes at 9 o'clock and at this place. Trust me, once you start this, you will get the results. And this is not for bariatric patient, this is for any patient. This is the thing for today. I think we are open for questions, and then I'll give you another homework if you are interested to do it. Anybody can ask anything. I think Mai has also joined.
Yes, sir.
I think we received your offer, and I think it's a very good thing. You can, I think I'll give you the head go. You can go ahead with your plan. So everybody has understood, or there is a confusion?
Sir, regarding the balloon, how long it is kept? Means for how many months it is?
The ideal duration of balloon is 4 to 6 months. See, there is a stitch there. Okay, this will open up, and patient will have a little bit of diarrhea, and then it will pass through the intestine and through the stool area. It can happen any day between 4 to 6 months. And how to check balloon is passed is very simple. They will get it in the stools. If they cannot recognize it, they can do a simple ultrasound or a simple X-ray, and there will be no balloon.
Okay. And sir, after injecting balloon, is there any symptoms the patient will after few days
after the insertion of balloon, right?
Yeah.
It's a very important thing. Before preparation for the balloon, we have to give patients 3 things. First, ask them to stop outside food. Amir will share you a video of the preparation of patient before Allurion balloon. Second thing is hydrate yourself. 3 liters of water in last 3 days. Because on the day of balloon, on the next day of balloon, they may not drink even water. And third thing is, on the morning of balloon, there are 3 medicines we give to the patient. One is an MSET medication, which is for vomiting. Second is a Pentop medication, which is for acidity. And third medication is aprepitant, we will share with you, which is given also an anti-emetic medicine. So first, on the day of balloon, and on the second day, the patient can have cramps, and they can have acidity or pain, like a small baby has come into the abdomen. So it's like when a baby comes into the abdomen, anybody feels nausea, vomiting for 3 months. This remains for 2 to 3 days, and trust me, after 2 days it will be absolutely normal. And a lot of patients say, sir, we don't know whether there is a balloon or not. How to check? Is balloon is there or balloon has passed? So it will happen after the 48 hours. So the first 48 hours, the patient has to be consulted before. Number 1, no outside food, otherwise the cramps will be more. Number 2, hydration before the balloon for 3 days, because on the day of balloon and on the next day of balloon, there is a separate module on it. The diet is very less. People may not drink even water. So they have to be hydrated before that. Otherwise, they will get headache. And once they get a headache, it will be very tough. And number 3, some medicines are taken on the day of procedure and 48 hours after the procedure, which I will explain you once I will tell you the diet and everything after the Allurion balloon, which is a module 4.
Okay, sir. Thank you.
But after 48 hours, 99% of patients are absolutely normal. What is risk percentage for the balloon bursting? See, this is a 4th generation balloon, and in the 4th generation balloon, the chances of bursting is almost negligible or 0. It is almost negligible or 0 because it is a 4th generation balloon. Anything else? And even if it bursts, it will pass from below.
So the pathophysiology is only that it's occupying the space, or is the hormonal changes?
Okay. Who is this?
Fatima.
Fatima is asking the question, right?
Yeah.
Okay, this is very important. The pathophysiology of Allurion balloon is tricking the brain. See, once there is a 550 ml of something, the capacity of brain is 1 to 1.5 liters. So once there is a balloon, the brain gets the signal it is full, and immediately craving goes away. But after 48 hours, the patient can start drinking, and they want to again get this thing that I want to eat my favorite food or my previous food. So that is the time the dietitian role comes into play, because there are no hormonal changes in this. It's just filling the abdomen, making the patient realize that the balloon is there and they don't need to overeat. It's kind of preventing them from overeating. Secondly, if they're eating wrong food, like somebody takes a hookah or a smoking after the balloon, or somebody drinks and eat a lot of non-veg material or a fatty material, they will get a lot of nausea. So it's a negative feedback. The balloon is sending the signal to the brain, this food is wrong, remove it from my menu. So second thing is the negative feedback. And third thing is balloon will make you learn to eat very slowly. Eat slowly, chew properly. So somebody asked, is there a chance the balloon can get stuck in the intestine? See, that is why any patient who has undergone a bowel surgery before, we don't put a balloon. And if there is a doubt, before putting a balloon, we do a scan of the abdomen with a contrast to see that all the system is intact. If that is there, the chances are negligible. Very rare to rare cases, if it gets stuck, we can do a laparoscopic surgery and remove it. I have not done it because I did not require it at all, but it can be done. Any other question? Don't worry, nobody is judging you. More you know, this technique is there, and this is the only balloon which is swallowable. All the other balloons are through endoscopy, so this technique will be here for years. And trust me, a lot of doctors have got it done. We had done a balloon recently 7 days ago on a doctor only, and a lot of people have got it done because it is a non-surgical procedure, and we have few patients lined up next month as well for this procedure only.
Sir, can this procedure be repeated after some time, maybe a year or a year or two?
Come again, please.
I'm saying, can this procedure be repeated after some time?
Okay, yes. Very important question again. Till now, according to company guidelines, this balloon can be put in the body 3 times at 3 months interval. Suppose somebody is 180 kg, they put a balloon, they become 150. The balloon passes away. After 3 months, they can get another balloon, they become 130. That balloon passes away. After 3 months, they can get another balloon, they can become 150 to 120. So maximum 3 balloons at 3 months interval after the passage of first balloon. Till now, we have done on 2 patients, 2 balloons.
Sir, will this cause any side effects?
Will this
cause any side effects?
Okay. See, it will cause side effects if the patient is not prepared well before the procedure. See, sometimes the cramp and the feeling of fullness is very severe in first 48 hours. So the patient has to be consulted. It is fine. In very rare to rare cases, if the patient has not hydrated themselves before the procedure, they may need an hydration. So they have to go to the hospital, get a IV cannula and 1 liter of hydration. They will be fine. So that is why pre-operative counseling is very important, that they have to hydrate themselves. And after that, it is almost, most of the patients say, doctor, we cannot feel the balloon. Yes, any other question?
Excuse me, sir. Like, if any patient wants to undergo a surgery,
your voice is very less. Can you just increase your voice?
If anyone wants to undergo
this
surgery,
who is asking the question?
Shahista.
Okay, yes.
So if any patient wants to undergo surgery, how do we decide if we have to go through this Allurion balloon procedure or if Roux and Weiss sleeve gastrectomy?
Okay, very good. So it depends on the BMI. Ideally, BMI between 25 to 35 is an ideal candidate for Allurion balloon. BMI more than 35 with diabetes or BMI more than 40 without disease is for bariatric surgery. But if somebody who is afraid of surgery and the BMI is more than 35 or 40, they can also go for Allurion balloon. But the weight loss will be 10 to 15% of total weight. Not like bariatric surgery where the weight loss is more, like 25%, 30%, sometimes 35%. Okay?
Thank you.
Hello, sir.
Yes.
So there's a question that if a patient is usually constipated or bloated all the time, is that safe to do this procedure?
Yes, very good question again. See, if the patient is constipated and bloated, that means their diet is not proper. Something is wrong in their diet. Maybe they are not drinking enough water, that is why they are constipated, or they are not taking high fiber food, that is why they are constipated, or they are eating a lot of outside food, that is why they have bloating. So once this balloon will come, I don't think they can eat like that before, because if they eat this outside material, they will have nausea. So the negative signal will go to the brain that this is not the right food, and that is the time where dietitian role is very important. Talk to the patient daily. Don't be afraid. You can only learn from the patient, not from the books. I have learned most of the things because I am personally there in all the groups. So any patient says anything, I can find out because I know the pattern. So talk to them daily. Don't be afraid. What is their issue? Listen to it. Don't think that, oh no, it is balloon. What can I do? This patient is not well. Once you learn what is there and you know the treatment, it will be very easy. And trust me, a dietitian can also put this balloon. If any dietitian is there who is willing to get partnership with us, there are few people who have already joined. I can teach you how to put a balloon, and you can also put a balloon after getting you certified from the company, because non-certified people are not allowed to put the balloon. It is so easy. And I forgot one thing, it has an artificial intelligence. There is a Allurion application where people have to download on their phone. There is a weighing machine which is connected to the Allurion application, and once the patient stands on the machine gives you the body composition analysis, that what is your weight, what is the body mass index, how much is the body fat, how much is the body water, and patient can see what is he losing. Is he losing fat? Is he losing muscles? If he's losing muscles, you have to add more protein in the diet. Okay. Thirdly, there is a new component which is coming, which is artificial intelligence with iris. What is it? If somebody has a favorite diet, once they feed into the system, if they go somewhere, they just take the help of the iris and tell me, please give me options. What should I eat here? And the iris will prompt that you can eat all these things. So this is a new technology which will be added, which has been added in US, and it will be added in India soon. Previously, we had a watch as well to check the steps, but now most of the patients have iPhone, which can do it. They can do it there. So now the watch is not coming with the balloon. Yes, any more questions?
So after the removal, after the balloon has passed
I think
out,
you have to be a little bit louder.
so after the balloon is like removed through intestine or through the anal passage, the how much chances are there the patient will regain the weight?
Okay, that is the most important part. See, what I have learned, if you have worked hard with the patient in 4 to 6 months, then patient has understood that what is the right diet, how I have to eat, that I have to do some activity daily. See, this is not a replacement of healthy diet and activity. This is not a replacement. This is adjunct. This is helping the patient to get all these things done. If the patient has learned it, after the balloon, the weight regain will not be there. But the patient has just passed this time. And once the balloon goes away, they will have that feeling that they can eat more. They will try. And if they think they can eat, they may regain weight. I think in our practice, we have seen 25 to 30% again regaining weight after 6 months to 1 year. And 60 to 70% patients who have understood the procedure. Some people have kept on losing weight even after the balloon has been removed. Like I showed you, this Mr. Rohit is more than 1 year and he is doing fantastic because he has learned what to eat. He also eats outside food, but he does regular walking. So if you have learned healthy lifestyle techniques from the balloon, the chances of weight regain are not there. But if you have not, chances of weight regain are there. And there the role of the dietitian comes into play. How much you interact with them. You try to call them one day, second day you stop calling them. You wait for their call. That is not the way you will learn. Even in your normal patients where you have given the diet patterns and you just talk to them once a week, I don't think you will learn a lot. Ideally try to talk to them daily. What will happen after some time, that it will become very easy for you to know the pattern, because most of the obese patients have a pattern when they will start gaining weight, and they have a pattern when they will start losing weight. So this pattern can only be identified when you talk to your patients daily. It will take only 1 hour. You can speak to 10 patients. That will be more than enough for you to learn. Because once you start learning them, it will be two things. You will not lose the patient because the patient will become attached to you. Number two, you will learn a lot of things which you cannot learn by just giving a diet chart. So talk to your patients who are on diet daily. Fix the time 5 to 6, 4 to 5, 9 to 10. Call them daily. And I ask my dietitians to give me a daily update. And if they are not giving me daily update, that means that time they are not talking to the patient. So it becomes very clear. And then after 3 to 4 days, the patient will message me that they have gained half kilo or 1 kilo of weight. And that is where we are going wrong. See, this 4 to 6 months or 1 year, 1.5 years after surgery is the time where the habits have to be changed. That is why I have told you habit stacking and implementation intention, the two techniques you have to put into your practice to become an see, there are good dietitians, you will become excellent dietitian. And if any celebrity will come to you for a weight loss, you will be sure that you will get the work done. Okay? Anything else?
Is there any supplements जो जैसे जैसे जिन्होंने सर्जरी करवाई है कोई न्यूट्रिशन डेफिशिएंसी हो जाए तो कोई सप्लीमेंट्स वगैरह उनको हम रिकमेंड
First of all, if somebody has undergone a surgery and they are already deficient before surgery, that has to be replaced in 3 to 6 months after the surgery. After sleeve, if your diet is proper, there is no requirement of any supplement after 6 months. But if your diet is not healthy, then you may need supplements like vitamin D. And after bypass surgery, mini gastric bypass or RYGB, the supplements have to be given daily. That is calcium tablet, iron, vitamin D once a week or 15 days, and antacid. All these have to be given daily, and a multivitamin tablet. Nowadays, there are chocolates where everything is packed in one chocolate, and they have to eat a chocolate in the morning and the evening. So very important that you should have a healthy dietary pattern after the surgery. Otherwise, you will have deficiencies, as well as bypass patients. If they don't take the supplements, the deficiencies will aggravate. That is why I am more inclined for sleep. I go for bypass very less because I know the patients will not take supplements after 1 year or 2 years or 3 years. Then they will start blaming that surgery is not right. That is because their diet still has deficiency of nutrients. Anything else?
So diabetic and hypertensive patient can undergo this?
Yes. Very good question again. We have done this procedure in diabetic and hypertensive patients, and once they start losing weight, they may not require BP and sugar medicine. So very important thing, ask your patient to measure BP and sugar every day. If the BP is less than 140/90, don't take any BP medicine. If your blood sugar is less than 150, don't take any sugar medicine. Dangerous thing is hypoglycemia, not hyperglycemia. And if there is any symptom of sweating, if by mistake patient has taken any medicine, ask them to take glucon D at once and ask them to check blood sugar. Because if sugar is less, they may think that this is because of balloon, but it may be because of sugar, because the diabetes is less. So once your diet is controlled, I think the sugar and BP gets controlled. And in second phase of diet, when the patient starts taking soft diet, then sugar and BP can increase. But that time you have to be careful that they are taking the right diet. So if patient has already lost some weight, see 5 kgs, 7 kgs, because weight loss is there, I think sugar and BP medicines in patients which is there for less than 5 years, they may not require sugar and BP medicines after that. It has happened in our group of patients as well. Same thing in bariatric surgery. After surgery, ask the patient to check BP and sugar daily. If BP is less than 140/90, don't give BP medicine. If sugar is less than 150, don't give sugar medicine. They will become hypoglycemic and they will have nausea, palpitations, and sweating, and then people will think they have some complication of surgery. Ask them to check sugar level immediately. I told you last time, 4 signs of emergency treatment. If they don't have any sugar in their home, ask them to visit nearby clinic or hospital, get it checked immediately. By doing this, you can save somebody's life. Anything else?
Hello, sir.
Yes.
Sir, is there any restriction like for this treatment these people can do or these people cannot do?
These people after 1 week can do anything. They can, after 2 weeks, they can join gym. After 4 weeks, they can do swimming, running. For me, the best exercise after bariatric surgery or after balloon for first 2 to 4 weeks is brisk walking. So slowly increase their walking, and once they are 40 minutes in a day and they are taking good diet, like good proteins in their diet, then you can shift them to gym, you can shift them to swimming, you can shift them to anything. But important thing is protein intake should be good, otherwise they will feel fatigue and weak. So the protein shakes and walking are two most important things after any procedure or even after your dietary part. Anything else? Anything else?
Sir,
Yes.
this treatment can be given to anybody, or else any like you can't give to someone. Is there any such restriction, sir?
Yes, there are. I told you two restrictions are there. If the patient has undergone a bowel surgery, so the balloon cannot pass from below. Second, hiatus hernia, where the stomach is inside the chest. A patient having lot of reflux in the night can have a hiatus hernia. So these two are contraindications for Allurion balloon. There are two more relative contraindications. A patient who is taking blood thinner and patient who is having cirrhosis of liver because of obesity and has developed varices in the stomach, which can be checked only by endoscopy, and patient has severe sleep apnea which is not controlled on BiPAP. If a sleep apnea is controlled on BiPAP, patient can undergo procedure. So two absolute contraindications: bowel surgery and hiatus hernia. Two relative contraindications are there: patient who is taking blood thinner after cardiac procedure, and patient who has cirrhosis and lot of varices in the stomach. Anything else? So are you all enjoying this, or is it a waste of time for all of you?
Sir, we are getting some learning as well.
Only one person is getting the learning.
Very interesting too,
All of
sir.
Okay.
It's a new concept and very interesting for us.
So I hope if we give you homework, you should do it. That will help you become a better dietitian. It is, I'm not giving you any marks. There is no exam. If there is a homework, it will help you, not me. I have 100 diet charts. I don't need a diet chart, your diet chart to give to a patient. I just want to know, if I give you a patient, are you ready or not? So if your diet chart is perfect, I can start giving you patients, which I will start from next week to few of you who have already done the homework and you are ready. So there are some people who have done the homework. I have given them my post-bariatric surgery diet chart. The rest people who have given charts, Amir will send my post-bariatric surgery diet chart today. So next week, if I give them patients, they are ready that what exactly they have to do. So it's up to you. There is no force. There are no marks. If you are interested, do the homework and it will help you in future, not me. So if you are interested, do you want another homework or no?
Yes,
Sir, we want. Sir, I want.
we want that.
So ideally, you should write a blog on various options of weight loss, starting from dietary thing to Allurion balloon to bariatric surgery. So that will make your concept absolutely clear, that which are the candidates for bariatric surgery, which are the candidates for Allurion balloon, and which are the candidates for diet only. See, both Allurion balloon and bariatric surgery needs your support. Patients cannot get the best results without your guidance. And if you people have your patients, try this habit stacking on them and try this implementation intention on them and try yourself as well. This is a technique which will help you and make you not a good dietitian, but an excellent dietitian. Okay?
So can you please repeat what exactly I'm supposed to do?
Homework, you are asking about the homework?
Yes, sir.
I am asking you to write a blog on various options of weight loss.
Okay.
Give a photograph. And second thing is, if you can make any healthy recipe which is high in protein content, any recipe, try to make it a beautiful recipe. It can be a healthy tikki, healthy paratha, healthy snacks, healthy salads. Again, it can be a detoxifying drink. Whatever you feel, you can do it and you enjoy doing it, because again, it will help you once you start seeing some VIP patients. Okay. So I think I thank all of you for joining, and those people who have not joined, they have missed something very special, because nobody in this whole world will teach you this thing in detail. And all of you have joined who have signed for the internship program. You are not interns. It is just a thing where we just want some bonding. So I can give you a certificate at the end of the procedure that now you are trained. And those people who are really interested, whenever there is a teaching program of Allurion balloon, I will see that you also get trained. And in future, I will allow you to do the procedure as well, if you are interested and if you are ready. So for me, if there is any new procedure, don't think that I am a surgeon. See, so even if I believe in this procedure, because I know everybody doesn't need surgery. And for you, trust me, everybody cannot be taken care of by just diet alone. They need some additional therapies. Those additional therapies like activity things, like Allurion balloon things, or a surgery in selected cases can help them reach their goal. Because a lot of times when we do surgery, patient tell us, sir, हमें तो पता ही नहीं था, we have lost 10 years of our life. So as a practitioner, you should have a cafeteria approach where you give them all options and just ask them to choose. That whatever they want, provide them. Don't force what we know is the best. Provide them what they want to get it done and tell them their advantages and disadvantages. Then you are an expert dietitian and a better dietitian, and maybe the expert dietitian at your place. Okay. So a lot of people have not asked questions. So I think they have understood everything. And this thing is recorded, and Amir will send you the link tomorrow. So you can watch everything again. And the third module will be diet after bariatric surgery simplified. So I'll teach you my tricks, what I have learned, that how to give a diet after bariatric surgery patients, and how to learn if they are cheating us or not. Okay. Thank you very much. And if there is any feedback you can give right now, that what exactly you want me to add in the modules. I think you have got all the modules. If you want me to add anything, I can add.